had for the last several years.
Representative Bradley.
Thank you, Mr. Chair. And thank you to my colleague. I got to sit on Health and Human Services with him, and I believe his heart is in the right place for providers. And I truly believe this is a hard cut for you, and I'm hoping that you're going to find the money somewhere. I just want to reiterate, I'm not blaming anything. What the good colleague from Mesa that's owned a business and truly has helped me fight for rural Colorado, Medicaid is growing 2 times the rate of inflation. I want everyone to hear that. When you take a program that's intended to be a swing and you make it a hammock, and then you start pointing fingers, you know the thing, what I tell my kids, when you point one finger, 4 are pointing back at you. It's an unsustainable path. It's an unsustainable path. Is everyone listening? It's an unsustainable path. We've grown an entitlement program we can't sustain, and now providers are paying the price, you guys. I can't keep begging. You have providers in your districts. And the abuse, $25 million for a rideshare scam. We don't even know about the wheelchair scam where they were charging $662 instead of $65 in 9 counties. We have a department in our state that's responsible for 1/3 of the budget that we have in the state, 1/3. They get $9 billion from the feds, $17 billion from our state. And we're not auditing them. We're not auditing their admin costs. We're not saying, what are you guys doing with all this money? Instead, we're saying we're going to cut provider rates. I'm asking you guys, let's audit HCPF. We have 2 different scams right here. The wheelchair scam in 9 counties for over 10 years. I can't even imagine. It was 1,000% increase. How much money that could pay providers that are taking care of the IDD community. You guys, it's 1/3 of our budget. I'm begging you, don't just say we're going to cut provider rates. And with that, I'm going to run or ask for J004 to be displayed to House Bill 1155. I move. I'm Rusty. I'm sorry. I move J004 and ask for it to be displayed.
The amendment has been moved and displayed. Rep. Bradley to, I believe it's J004.
Thank you, Mr. Chair. So you've asked for us to come up with the solutions. I don't have a solution for provider rate decreases. I know we're asking for $170 million, and that's what provider rate decreases is going to be. So here we go. I'm going to ask to move about $2.5 million of total funds, including 1.2, because it's a federal match. So I'm only asking for half from the general fund from personnel services in the executive director's office to medical service premiums to eliminate the annual hours cap on personal care, homemaker services, and health maintenance activities provided to persons with intellectual and developmental disabilities. And let me tell you why. When I was sitting in the SMART Act hearings, and we all got emails from parents that are only going to get 56 hours to take care of their children, and the department looked at me and said, we're being generous. We're being generous to those parents. I wonder if we're actually hearing what we're saying. We're going to be generous to give parents $8 an hour, by the way, 56 hours a week to take care of their IDD and DD children. And I just want to tell you, when my son was in this horrific accident and was in a wheelchair and couldn't walk up and down the stairs, do you think that was only 56 hours a week? Because I was showering him, bathing him, doing all the things, and it was temporary. And these parents have emailed all of you, and they didn't even get emails back from you guys. And to say that that's generous, to give them 56 hours to care for their children in wheelchairs? My son was in a wheelchair for 3 months. I was his caregiver nonstop. So let's talk about a couple things. In 1988, the autism rate was 1 in 10,000. Now it's 1 in 30. We're spending millions of dollars on 2,000 cases of syphilis, 34 cases of measles, millions of dollars. And then I had a testifier come and say, what are they supposed to do after the 56 hours runs out? Where are the providers? They're only making $8 an hour, so what providers are they supposed to pay? One testifier said that she's been on a wait list for years to get a respite provider for a few hours a week. There's no providers, you guys. There's no providers for these families. So we're going to cut their costs to care for their children, and then we're leaving them in the dark because there's no providers that are going to come into their homes and take care of their children. And the ones that do are taking 30 to 50% off the top of the wages. It has become a moneymaker. It has become a moneymaker for providers to go into these homes that these poor families cannot pay because we, the state, have said we're being generous to give you 56 hours. So let's read a couple. I'm writing you to oppose the proposed 56-hour IHSS caregiver cap and the implementation of the age-based calculator. These changes will not change the care my son needs or the needs of others. Hunter is our medically complex 14-year-old son. He has a rare genetic disease, PIGA. There are less than 200 cases worldwide. Less than half of the number is still living. Hunter is nonverbal, legally blind with cortical vision impairment, hearing loss in one ear, spastic quadriplegic cerebral palsy, Lennox-Gastaut syndrome, which is a severe form of epilepsy, feeding tubes, and oxygen requirements. But we're being generous to give his mom 56 hours in this state. This is just a small list of what we deal with daily. I have cared for my son since the day he was born. He was not expected to live to see his first birthday. Many of the doctors have said that is because of the extreme care that I provide him. Before our son was born, her husband of 30 years had successful careers outside of the home. I need to end my career to become Hunter's caregiver. As the years go by, his needs have increased. Jay has also left his career to assist in Hunter's caregiving needs. Hunter is approved for, and rightly so, 168 hours a week, but 56 hours is generous. They were approved for 168 hours a week. He needs 24/7 care, eyes on him at all times. Some of his seizures are silent, and if you are not right there, you don't know that he is in distress. This breaks my heart. He requires life-sustaining medication at least 4 times a day, constant monitoring and charting, close communication with complex medical team. His bedroom mimics a hospital room. My bed is 3 feet away from him, so I can be at his bedside in the blink of an eye. He's had 3 major surgeries in 2 years' time, bilateral hip reconstruction, craniotomy, and just last week, spinal fusion. Hunter is never without me or Jay by his side. He's never spent a night or day in the hospital without me next to him. And boy, can I relate, because I was there for 6 weeks with my child. The proposed 56-hour cap will greatly affect us. It will cut our income by more than 50%. We do not live extravagant lives. We have lived in the same house in rural Elizabeth for 24 years. We have remodeled our home 2 times to accommodate Hunter's needs. We have purchased a handicapped van so we can safely transport him to all of his doctor appointments and hospitalizations. None of this is covered by funding. The loss of income will affect us being able to provide things for him as he grows and his needs change. This is what we're cutting. Where we live, we cannot find reliable help. Our family is all older and unable physically to care for him. Respite providers and private duty nurses are in great demand. Most are not qualified to care for Hunter. Some do not want to commute this far. She has not had a provider in her home since April of 2019. I do not understand how this cap is going to help with caregiver burnout. My thought is it will make it worse. Right now, I work 112 hours, and Jay does the other 56 hours. It works for us. With the caps, Jay will have to take another job outside the home, so he will still work 56 hours as a caregiver, and then another 40 hours outside the home, while I am still working 112 hours as a caregiver with the pay of 56 hours, which is $8 an hour. This is just our situation. I know several families who have a much more difficult daily life. These cuts will put undue stress on families that need the highest support. I foresee a higher number needing SNAP, TANF, and housing assistance, not to mention the mental toll that the representative from Mesa talked about. It will place on families that are now forced to make decisions that can and will put their children at higher risk. As a mom, I cannot understand that, why this state is putting them on the chopping block. How does the cap save money if the state will need to pay outside caregivers, which is the biggest thing, right? We're giving them 56 hours. They're still going to have to find another 112 hours, just this family alone. If their children are placed into institutions that are already understaffed and overpopulated, then what? How do they propose families to find adequate skilled caregivers to help when everyone is forced to outsource, but there is a nationwide shortage that has been in place since 2020? This is just one of the many emails that we all got because y'all were all CC'd on it. Did you write them back? Did you call the people in your communities whose care has been cut for their children that need lifelong care? And here our state says we're being generous, that you need to sleep, that you can't provide good care for your children. Tell that to a mom. We don't sleep. I haven't slept since September 11th. These poor families have it 10 times worse than me. And this is what we're cutting. Come on, you guys, do better.